Deep group of muscles are also two in numbers. They are levator scapulae and rhomboid muscles. Levator scapulae muscle lies deep to the sternocleidomastoid muscle superiorly and trapezius muscle inferiorly. It arises from the transverse processes of C1 to C4 vertebrae and attaches to the superomedial border of the scapula. Levator scapulae is innervated by dorsal scapular and C3, C4 cervical nerves. The actions of levator scapulae include lateral flexion of the neck while acting alone. It acts with the descending fibers of trapezius to elevate the scapula, rotating the glenoid cavity inferiorly, or resisting forces that would depress it, as when carrying a load. Also, it acts with contralateral muscle and together with trapezius muscle to extend the neck. Rhomboid muscle has a rhomboid appearance and may be subdivided into rhomboid major and minor, although not always clearly demarcated from each other. They lie deep to the trapezius muscle and runs inferolaterally from the vertebrae to the medial border of the scapula. Its proximal attachment includes nuchal ligament and spinous processes of C7 and T1 vertebrae for rhomboid minor and spinous processes of T2 to T5 vertebrae for rhomboid major. Distally, rhomboid minor attaches to smooth triangular area at the medial end of scapular spine, while rhomboid major attaches to medial border of the scapula from the spine to the inferior angle. The muscles are innervated by dorsal scapular nerve. The rhomboids are in action when forcibly lowering the raised upper limbs, for instance, when driving a stake with a sledgehammer. They also retract scapula and rotates the glenoid cavity inferiorly. In addition, rhomboid muscles work with serratus anterior muscle in holding scapula against thoracic wall. If this video is helpful, consider subscribing to this channel.